Hi, this is Dr. Christopher Wellwood at the Regenerative Medicine Institute. I've got a volunteer here today who we're going to do a knee injection on him. Now, the interesting part about this young man is that we've done his knees a couple of other times before and he's had significant relief, but now we need to actually do the ligaments on the outside. So one of the reasons why we do the ligaments is because sometimes the knee rocks back and forth, and when it rocks back and forth, it causes pressure and pain and fluid buildup. So we are going to try and stabilize that with some Prolozone today, and with the hopes that it actually stabilizes that knee and it doesn't rock it back and forth and cause the inflammation I was just talking about. All right, so I've already cleaned and prepped the patient, and we'll go ahead and do the injection. So as you can see here, I've actually marked an area right here, which is called the lateral collateral ligament. And this is often injured when a person bends their knee to one side like this, or the other way. You can kind of see it actually moves just a teeny bit at a time. I don't know if you can see that, but right here you can see it pulsating right there. So it shouldn't actually do that. It's a pretty unstable joint. So we're going to go ahead and inject that area right in here. Then we're going to get right underneath the kneecap right here. There's a little bursa or fluid-filled sac right here. And then we're going to get the medial collateral ligament on the other side. So here we go. So we're going to go ahead and inject the vitamins right in that ligament. We know it's in a ligament because it tends to kind of go right through there. There we go. You can see it puffing up. Good. Now we're going to switch out for the ozone. And you can see it blowing up. And there's the ozone. I'm going to inject a little bit more ozone around here so we can kind of seed the area. There we go. Now that we've got the lateral collateral ligament done, we're going to go ahead and get underneath the kneecap itself. You can see I've actually made some marks here. This is the patellar tendon right here, and there's a fluid-filled sac right underneath it. So we've got the table lowered just a teeny bit so we can go right underneath the kneecap itself. Right in there. And oftentimes the patient will say that they're having pressure under there. We're going to exchange the vitamin mixture for the actual ozone itself. And there we go. Good. So, sometimes when a knee gets injured, ligaments get damaged. And this ligament here is called the medial collateral ligament. And what it is, it's the point where the upper bone here called the femur and the lower bone here called the tibia connect. And there's a little piece of ligament that runs through here all the way down here. And when it gets injured, it gets torn. And when it gets torn, it becomes loose. So we're going to go ahead and inject right into that junction right there. We're going to seed the area in some vitamin mixture. Good. Now we're going to exchange the vitamins for the ozone. You can hear it going right in there. There we go. That was a medial collateral ligament injection.